The United States has laid out plans to combat Omicron as the COVID-19 variant takes further root in the country. President Joe Biden's plan revolves around more jabs and more tests. 500 million rapid tests will be made available to Americans free of charge. Well, Simon Marks joins us live now. Simon, mass vaccinations and testing and even deploying troops to help in this effort. Just wondering what's been the response to President Biden's anti-Omicron strategy.
Well, if you take a look at the Wednesday edition of the New York Times, you will find a newspaper that has struggled to find a public health analyst who believes that President Biden is going far enough. And to a significant degree, the plan that he unveiled in that speech at the White House yesterday is really designed to help America get through the Omicron surge that is coming, rather than in any way combat it or push it back. There are still enormous questions about some of the president's announcements, including that plan to purchase 500 million rapid test kits that the US government at some point in January, we don't know when, will make available to the American public. The eligibility criteria for getting them unknown, the website for registering for them as yet still in the design phases. Questions too about the extent to which the resources that the White House says it's bringing to bear, additional beds for hospitals, for example, are what the healthcare system needs, because you're seeing many doctors and virologists all over the country say it's not beds that are the primary problem as a result of Omicron, it's keeping staff available in the hospital system. That's one of the reasons why the president is pointing to this decision to put medical personnel from the military on standby to help in civilian hospital systems as this variant continues to spread. But the president noted in his speech yesterday that he understands the American public are tired of COVID-19, and it was evident from the presentation that he made that he doesn't think that American society is willing to accept particularly tight regulations or restrictions. So no changes whatsoever in Christmas plans, no recommendations on the number of people you're safe to gather with, and absolutely no hint at any kind of travel restrictions on the eve of a Christmas season that the president's own chief medical advisor says is going to serve as a super spreader event for Omicron.
Well, as you've mentioned that, obtaining these tests, it's still a question mark. Then what is it we're hearing about COVID treatment plans in the U.S. poised for a boost?
Well, that's the glimmer of light that exists here this week. We may hear later in the week, we expect to hear later in the week from the Food and Drug Administration that they're granting authorization to those two therapeutics that have been developed respectively by Merck and by Pfizer, pills that people can take to help offset the worst impacts of COVID-19. The White House and public health officials here argue that has the potential to be a turning point in the battle against COVID-19, not just in the United States, but around the world. The Biden administration has pre-ordered millions of doses, 5 million doses of the Merck drug, 10 million doses of the Pfizer therapeutic, waiting for this FDA approval to come. We don't know how long it's going to take for those millions of doses, again, to be acquired and to be distributed, but certainly they have the potential to assist turning back the worst impacts of COVID-19 as Omicron and additional variants potentially continue to wash around the world.
Simon Marks in Washington, D.C. Good talking to you.